Hmm.
Hello everyone. So today we are going to perform the dissection of the back muscles. So for that we have to find certain landmarks. Which are the first landmark is we have to find the occipital protuberance. Posterior occipital protuberance is the skull's eminence which is present onto the posterior aspect of skull. So after finding that posterior occipital protuberance, we have to take a one vertical incision which will extend from posterior occipital protuberance up to all the way up to L5 vertebra. So after taking that incisions, there are other incisions that we have to take. The one incision which is horizontal, that we have to take from the lateral end of the clavicle up to the C7. So after taking these incisions, you can remove the skin flap. So we have already removed the fat which is present into the back, and now we can expose the muscles which are present into the back of the human body. So you can see over here there are two main muscles which are present in the back. First one is the trapezius, which is also known as a diamond shaped muscle, because if you see the shape of these muscles, it looks like a diamond shape. That is why it is known as a diamond shaped muscles. And the another one is the latissimus dorsi, which is present in the lower part of the back. So first let us discuss about the trapezius muscle. So trapezius muscle has three fibers. The first is the descending fibers, which is originate from the posterior occipital protuberance as well as up to the spine of C7 vertebra. Then the horizontal muscle fibers, and the last one is the ascending fibers. So if you see, this muscle which is known as a trapezius is originating from the posterior occipital protuberance up to the C7 vertebra spine, and after it originating from here, it will moving towards the lateral aspect of the body. After moving towards the lateral aspect of the body, this muscle fiber is going to insert into the lateral 1/3 of the clavicle on its posterior surface. Another one is this horizontal fibers. So this horizontal fibers is originating from the spine of T1 to T4 vertebra, and after originating from the T1 to T4 vertebra, it will move towards the lateral aspect, and after moving towards the lateral aspect, this fibers is going to insert it into the medial aspect of the acromion process as well as upper lip of the spinous process of the scapula. The last one, which is the ascending fibers, which are coming from the spine of the T12 to T5 vertebra. This will directing like this, and it is going to again fuse together. All these fibers is going to fuse together, and these fibers is going to insert it into the deltoid tubercle of the scapula. So this is about the trapezius muscle. Trapezius is one of the big muscle of the human body, and again it is known as a diamond shape of the diamond shaped muscles. Okay, so the next muscle is latissimus dorsi. You can see over here, this is the big muscle in the back of the human body. This latissimus dorsi is going to take origin from the iliac crest on posterior aspect as well as onto the lateral 1/3 of the iliac crest. So this fiber is originating from the iliac crest on its posterior aspect, lateral 1/3, and after originating from that, it will also take origination from T12 to T4 vertebra, and after originating it, this fiber is going to merge together all together, which is you can see over here, and after that it will converge itself and taking a U-turn, and after that it will going to insert it into the floor of the bicipital groove. So this is about the latissimus dorsi. After talking about these two muscles, we have to talk about one of the most important clinical aspect of the back. So you can see over here there is one triangle which is present on the back, which is known as a triangle of auscultation. So triangle of auscultation is the place where we can put a stethoscope and can perform the clinical examination of auscultation. So you can see over here, this triangle, this space is known as a triangle of auscultation. So the triangle of auscultation is formed by the trapezius muscles, medial border of scapula and latissimus dorsi. If you observe, this is the triangle of auscultation. So the medial border of triangle of auscultation is formed by the lateral border of trapezius muscle. The lateral border of triangle of auscultation is formed by the medial border of scapula, and the floor, or you can say the base of this triangle, is formed by the latissimus dorsi. So this is about the triangle of auscultation.